you need a feedback. So if you communicate effectively, then there will be either a positive feedback. If you communicate negatively, there will be a negative feedback. So with every communication, there should be a feedback. So in brief, that is what communication is about. It's a two-end channel.
Oh, all right. Thank you very
much.
Yeah, thank you very much. So, Mr. Kojo, Dr. Amwa, you're welcome. You are a healthcare specialist. In fact, your thesis is in the area of effective healthcare. So, how do you see the role of communication in providing effective healthcare from where you sit as a healthcare advocate and nursing environment? Yeah, Mr. Gujamwa. Okay, so I think Kojo is not with us.
Hello?
Yeah, okay, yeah. I was asking how you are an expert in the area of effective healthcare, but your PhD thesis was among nurses in the area of healthcare delivery. So I'm asking, how is communication? How does communication play a role in advancing effective healthcare?
Okay. Communication is very important when it comes to healthcare industry. Because there are styles of communication. So communication can be, it depends on your style. You have passive communication. You have the aggressive communication. And then we can also have passive aggressive communication. Then we can have the assertive. But it is believed that the assertive communication style is the best.
Can you throw more light on some of these terms you have just informed us? What's the difference?
No, I didn't get you. You want me to throw more light on the
various forms of communication, the assertive and all that. So can you throw more light?
So the word aggressive. Those people that communicate, that have the style of aggressiveness, they are very loud. They will not want to bend, and they don't want to accept their mistakes. So they impose. That is basically what the aggressive type is all about. But the passive, they are inwardly, they shy away from sharing their feelings. I would say that it's because of maybe self-esteem or low self-esteem or something like that. That is why they are not able to express their feeling. So such people have that resentment and bitterness within. But the aggressive type are very open, and then they are straightforward. Okay, the aggressive one, they don't think about your opinion. Your opinion does not matter, but what they want to communicate, that is what they want to communicate. And then the passive one, they listen to your opinion, all right, but they are not able to express their opinion well. Now, with the assertive type, that is, according to research, it said that is the best style of communication. And, communication is actually linked to your temperaments. The melancholics, the cholerics, the phlegmatics.
Okay. All right. So, Dr. Kenneth Denfu Amwa was saying that communication is linked to your temperament.
Sorry, I think I'm having a network challenge.
Okay, so you said that communication is linked to your temperament. Hello.
Yeah,
Okay.
communication is basically linked to your temperament. So if you're melancholic, or if you're melancholy, you know, the cool type, they are very secretive and they don't, so mostly can be linked to the passive aggressive type. So that is what I could say there. And then for the cholerics are more action oriented. So mostly they want to get a thing done. They want to meet deadline. So because of that, they don't want to take the opinions of others, because what they have said, that is what they want to achieve. Okay. Now there is a new research area that has brought the fifth temperament, that is the supine. Okay, that is the fifth temperament that we know now. It combines all the four temperaments. And I can link that one to assertiveness, being assertive. Assertive means that listening to the opinions of others. And as effectiveness and nursing professional, you need to listen to your patient, because in my
we lost him there. Yeah, but welcome, Diana. We are talking about the various forms of communication. And then Dr. Demfo was talking about how one communicates is linked to the temperament of the person, of an individual. And he was saying that we have the assertive, and then we have the passive, and then we have the aggressive form of communication.
Yeah.
And then we have
sorry. I'm just so sorry. I'm having issue with my network. I'm so sorry.
That's okay. And then you went ahead.
Can I go?
Yeah, go ahead.
Yes, sure. So basically, my thesis, I looked at the 5L principles, and one of the L's has to do with listening. And you know, listening is a skill. Okay, we can have different types of listening. We can have the pretentious listening, like the person is listening to you but is not listening to you. We can have the therapeutic listening that is linked up with the health sector, and that is what an effectiveness need to get. It's a skill that an effectiveness need to know and need to get it and learn it, because you need to listen to your patients, listen to the problem that he came with before you be able to administer any treatment, or you'll be able to refer the patient to the respective professional to treat him or her. So the assertive style talks about the fact that you need to listen to the opinion of others, and they are very firm. Assertive type of communication are very firm. They are very firm. They don't bend, but the fact is they listen to the opinions of others. They understand what we call brainstorming. They listen to the opinions of others, and then they filter and they make sure that they get the best. So basically, that is what I would want to share with it. And I think listening is the major skill that we need to develop as health professionals, which is very, very important, because you need to listen before you can administer treatment. Thank you.
All right. Thank you, Dr. Demfo Amwan. So, Diana, you just joined. Is there an ideal way when it comes to communication as a healthcare provider? Do we have, in your opinion, have an ideal way? We have spoken about the various forms of communication. We have spoken about the various forms of temperament. And so how do we marry the two? It's an ideal way from the perspective of a nurse or a midwife. How are they expected to communicate to their patients? Do we have an ideal way? Yeah, Diana, this is to you.
Hello, is the question directed to me?
No, this goes to Diana, Madam Diana.
Hello.
Okay. Yeah. So, Ida Mensa, can you take that question? Is there an ideal way
Hello.
to communicate as a healthcare provider? In your opinion, do you think there is an ideal way we can communicate?
Thank you very much, David. I think there is.
Hello.
It depends on one person to the other. In communication, when you are speaking, it's said to be the exchange of thought by using speech or other means, which could be non-verbal or verbal communication. And the verbal communication deals with speaking, that's oral communication, and it also deals with writing communication. And the non-verbal deals with the posture, your gestures, facial appearances. So it depends from one person or one patient to the other. There is no definite ideal way of communicating to one person to the other, but it depends on the situation um, and where the communication is taking place. Within the health sector, I think it depends on first or with the professionals. You have to look at the right at the timing, whether the timing is appropriate. You have to also look at whether the relationship between the patient and the client, which is very important, because if as a professional, the more you establish relationship with a patient, the more you are able to communicate effectively. And also it also depends on the situation. I am coming to you as a professional seeking for help. I'm trying to get my concerns around, and I need a form of assurance or a form of treatment or diagnosis. If I am coming to you and I there is a barrier basically in terms of the social circumstances, in terms of language barriers, then it means I will not be able to communicate effectively with you. Which means I will not be able to send across what I want to send to you. So I think it depends. It depends from one person to the other. It depends on the type of concern that is being shared. It depends on the type of diagnosis that is being shared. An example is if a patient is coming to you with a terminal cancer, the kind of communication or advice or information that you, a professional, will give to that patient is different from a person coming to you with malaria or just headaches. You get where I'm coming from. So
Yeah.
I think it depends on the situation, the timing, the circumstances, the illness, the environment, the space, all that. Yeah.
Okay. All right. So Ida, let's say you made mention of barriers. You made mention of barriers when you were trying to let us know the ideal way when it comes to communication, which you said we don't have an ideal way when it comes to communication. The situations and all that goes into how you communicate. You said that a person with malaria and a person with a terminal cancer, the communication will vary. So I want to ask, what are the barriers between the recipient and the provider of healthcare? Do you have any barriers in terms of communication? One who is giving the instruction and the one who is receiving the instruction by way of the patient. What are the barriers? What will cause the information or the relay of instruction not to sit well with the recipient, or and vice versa? So either
Can you
you
hear
can
me?
learn.
Sorry.
Yeah, can,
Yeah. There are several barriers when it comes to communication. One is language. Um, um, Language plays an important role when communicating. If we speak the same language, if we are coming from the same direction, if we are looking at the same thing, then we'll be able to come to a conclusive understanding, basically, or we will be able to come to a similar understanding. An example is if I am a health professional coming from maybe France, into the Ghanaian community, and I don't understand. I am placed in an environment where most people speak Twi, and I'm not able to express what I am communicating with you in Twi. Then it means there is no communication at all. Because when you come to see me, I will not be able to understand you, to be able to advise or diagnose, and you too will not be able to understand where I'm coming from. Culture also plays an important role. Basically, when it comes to communication, values plays an important role when it comes to communication. Training if plays an important role. With health professionals, the one thing that we from reading and from research, it says that if a person is not effectively trained in the field that is being practiced, then you are not able to have more knowledge or have more information to share when it comes to providing a service or during practice. So you are not able to
Okay.
give diagnose, you're not able to, yeah. So it's these are some of the barriers when it comes to communication, and also the space and the environment. If I am diagnosing a person in a public place, um, then it means how effective is that diagnosis going. I'm coming to you with my concern. I'm coming to you with an illness. I come to the hospital, let's say a hospital environment where you have children playing about, you have animals running about. How would the patient trust your diagnosis that you are given or the information that you're given? So space and the environment also plays a role, and then the credibility of the person also plays a role. It's also a barrier. I Let me say, an OT cannot diagnose a cancer, uh, a cancer patient. Or that's why there are specializations in within the health professionals. A social worker cannot diagnose. What we do is we provide an assessment, and then we help channel what kind of support you need. So I cannot come in and say that I'm diagnosing someone with an illness. It has to be a clinician or a consultant. So all these also have plays a role when it comes to communication.
Thank you very much. I see Mr. Rick Orchard's hand up. You can go ahead.
Yes.
Make your
Yes,
comment.
Doc. So what I wanted to say is that there is a clear difference between talking and communication.
Okay.
Most often, from observation, when you go to our health centers or hospitals and clinics, what I observe is that most of our health professionals talk, they don't communicate. There's a clear difference between talking and communication.
Okay.
You
Okay.
could be talking but not communicating. Again, we also have to notice that the first medication the patient takes is the word you use in communicating. Each word is medication. Each word you
Okay.
use in the communication process is medication.
Okay.
And as Madam Diana said, it is not just communication is not just verbal, but also non-verbal. Your body language counts a lot. You may be talking to the person, but your body language may be saying something else. And so I believe that if we're able to watch our body language, it will communicate more than just what we say. Thank you.
All right. Thank you very much. So, Madam Zaina, you can give your submission.
Okay, thank you. Ricky was talking about the non-verbal communication, and looking at the barriers, there is one thing too that I want to bring across. It is good to use the non-verbal, but sometimes too, you need to make sure the kind of non-verbal communication skill you are using for the gender, because there may be a way you can communicate with a lady. The same way, if you communicate with a gentleman, it may mean different thing altogether. Like the therapeutic touch that we use like this. You can touch a lady maybe on the hand. It will be okay if you're a lady. But if a lady should do that with a gentleman, it may be taken for something different. So if we are using things like that, we need to also make sure it wouldn't cause any problems in the future. Another barrier that I want to talk about is the health status of the patient. Since we are dealing with patients or health workers, I want to use patients or clients. Most times, if you want to communicate with them, you have to make sure if that moment they are in a state that they can communicate back or even accept what you're going to tell them. If someone is in severe pains and you want to talk to the person might not be so open to you. Maybe you have to wait for a while for the pain to come down before you can communicate with that person. So health status sometimes also become a barrier. Then the developmental level and the knowledge level, the way you deal with an adult will be different from the way you deal with a child. Okay. When you are dealing with a child, maybe you need a bit of persuasion, bringing in toys and all those. That is different from dealing with an adult. So when you are communicating or in communicating, you have to make sure that at this level, maybe if I use these terms, if I use these words, the person will be able to understand. So sometimes that one to become a barrier. And the last one I want to add is our attitude. Rick was saying that nurses, we don't communicate. We talk to our patients. Yes, our attitude towards the patient. Sometimes they just need us to smile at them, but we are so preoccupied with our own issues coming from the house, the least thing gets us agitated. And so if the person is even coming to talk to you, they're afraid. And so our attitude sometimes also become a barrier for communication. Thank you.
All right, so I see Dr. Benfo, your hand is up. You want to make a submission?
Yeah, thank you very much. I think we need to establish the fact that there should be an ideal communication style. If we can define it here, so that we can train those we are training, so that they will know that there are an ideal, or there is an ideal way of communication, that we can find it here. That is my first submission. Then secondly, I remember that when I was doing my research, I went to one of the cities in India. And you see, on my questionnaire, I asked of whether because of culture, we're denied treatment. And to my amazement, most of the comments that I received, you know, in India, they have this caste system, and they have the backward caste system, then the forward and all those things. Like, I mean, so the comment I received was, the doctor was not willing to touch me as a patient because I'm from a lower caste.
Oh, was the doctor a male or a female?
Say?
Was the doctor a male or a female?
Oh, the doctor was a male.
Okay. Okay. Right.
Yeah, was a male. But see, so he was not willing to touch. But sometimes, see, culture can also play a major role where barrier.
Okay.
And
so
basically, it is very true that culture play a major role, but we need to understand the culture of others, and then we need to adapt to it so that we can be communicate.
So,
hello?
So yeah, I can hear you perfectly. So I want us to marry the two, something here. When social worker Ida Mensah was giving her submission.
Hello.
Yeah.
You can hear me.
Yeah, I can hear you. So
yeah,
when
so
social worker, I want to go further, probe into what you just said. Is that okay? Yeah, so when Ida Mentor was giving her submission, she said that there is no ideal way when it comes to communication. But
Hello, Doc. I didn't hear what.
yeah, I'm saying that when you were giving your submission,
Yeah.
you said that we need to define an ideal way of communicating.
Yes.
Yeah, and I'm saying that when the social worker Ida Mentor was giving her submission, she said that there is no ideal way of communicating because situations vary. Each situation demands that you change your style of communication. And it made me of when you are communicating to a child, to an adult, you may communicate in the same manner for the two. And so I want us to marry the two here. So Iramenta, can you come in?
Um, yeah, with I don't know how to say this, but for me, that's my thought, basically, because when I am, like an example, when I'm working with a child, the way I would communicate with a child is different from the way I would communicate with an adult. And within the adult, when I'm communicating with an adult, I have to also look at certain things. First of all, that is this has to do with the channel flow of communication. Does the person is one, does the person has any disability when it comes to understanding or understanding the communication? We do have something within the law that's it's mental health capacity assessment. When I'm working with a someone in when I'm supporting someone in an adult, first of all, I have to look whether the person is able to communicate. That is either verbal or non-verbal. Some people can communicate in a verbal form, but
Okay.
they can use the non-verbal communication. And that's example using the sign language, your body posture, face-to-face contact. That's the eye contact, using signs and all that. And then I have to also assess whether the person can retain the information I am giving or what I'm doing. An example, if I go and someone needs support, basically, maybe to get support to go into the community. I have to explain why I have to understand why the person is not able to do it independently by self. Do you have any other networks that can do it? So what I'm trying to explain, the importance of you going into the community to prevent isolation or social exclusion or loneliness, an example. Is the person able to retain this information? And then the third one is the person able to weigh the information? All these form is part of the communications, and if you are not able to weigh the risk, you are not able to weigh the advantages, you are not able to weigh why you need to do it, then the person is not able to make the decision. So when I'm talking to someone who has more knowledge, as the other speaker said, about certain things, because we do have various patients that comes to us. Some have are really educated, some are semi-educated, some has no formal education. So the way you would communicate with someone who is well advanced with a with training, or maybe before someone who has knowledge, when I diagnose cancer, will go on the internet and read about it. So it would be easier than someone who has no formal understanding or not no information about cancer. So you need to start from the basics. That's why relationship plays um, an important role in communication. Yeah. And when I say relationship, it's your ability to distinguish between professional and personal relationship. So there is a barrier to the kind of relationship that you do have um with your patient. I don't know whether I'm making sense in the thing.
Yeah, I think you've cleared it. But one more thing before I see Madam Dinah's hand up, and I also saw Sariki's hand up. I think what Dr. Benfu Amwa was saying is that there should be an underlying posture that will work for various categories of persons that we have to communicate with. Yeah, so I don't know if Dr. Ken will come in here.
Madam.
Yeah, Dr. Ken. Can you come in here? All right, so
hello, Doc.
Yeah, go ahead.
No, help me with what you said.
I'm saying that from the affirmations of the two of you, tempted to comfort, saying, fine, we should have an ideal way of communicating.
Yeah,
but,
I actually.
But there should be an underlying that will do for any category of persons that we are communicating, whether a child, whether an adult. There should be a baseline that will work for all of them.
Very well. Yeah. So thank you very much. So I would say that respect.
Okay, respect.
Empathy.
Empathy, okay.
Empathy.
Okay.
And compassion.
Compassion.
See,
so these three.
Yeah, compassion. You know, compassion is the feeling you have. The feeling you have for someone, like you're feeling the same thing, but the extension of compassion is that you are willing to help, irrespective of the situation. So whether the person is a child, an adult, respect, empathy, and compassion should be underlying factor in our communication. Thank you.
All right, good. So the baseline that will work for any health professional when dealing with a patient is that, like Dr. Kenneth Benfu Amwa said, respect, empathy, and compassion. There's a difference between compassion and then passion. Compassion is just feeling sorry, and then compassion, like Doc said, is feeling sorry, yet going to the extent of providing help. And so for those of us that are students among us, I think this will be a take home for you. The baseline when you are communicating as a health profession or professional is that you should have respect for the patient. By having respect for the patient, you cannot treat the patient anyway, anyhow. And then empathy, put yourself in the person's shoes. And then also compassion, be willing to help. Sometimes you go to the hospitals and then you need help. You need to even want to ask information, you need to get information, but the posture of the health professionals even is not welcoming for you to even go near them. And so I think that is a going there. I saw Madam Dinah's hand up. So Madam Dinah, you can go ahead with your
Oh, you asked about how we were going to marry the two. Okay. And I wanted to talk about that there can be an ideal way.
Okay.
But we are, just as Ida said, you can't use one way if you are using that for a child, you can't use the same way for an adult. So the ideal way, we can tailor it to specific patient needs. So depending on the needs or the developmental stage or the knowledge level of the person, you can have a tailored ideal way of communicating with that individual.
Okay. All right. Thank you very much. Ricky, you can go ahead.
There's also a saying that you can't be too emotionally involved with the patient. And so, because if you are too emotionally involved with the patient, what happens is that sometimes you cannot do exactly what you are expected to do.
Okay.
Because out of too much compassion, you may feel so much for the patient that the patient has to take the medicine, but he's crying, I don't want to take it. But out of compassion, you leave what you are supposed to do, the primary objective for what you are what you are supposed to do. And so I believe that there are checks and balances to everything that the ideal way. Okay, so if you are too compassionate, you may also fail to fulfill the task for which you have been asked to do. And I think the major thing is being empathy, showing empathy, letting the person know, or be in the person's shoes, and then letting the person know what I'm doing is I'm also doing it to help you. But I think one of the key barriers in our modern world today to communication is social media. I think we've not mentioned it yet, but I'm talking from observation. When you go to our hospitals, our clinics, and our health centers, social media has gotten the attention of most of our nurses.
Okay.
Social media is competing with patients at our clinics, in our hospitals.
Okay.
So much so that sometimes social media takes the lead ahead of the patient.
Okay.
I want you to just go to any of the hospitals or clinics and then check how many nurses will be holding their phones. And then when you check on what is happening on their phones, they are on any of these apps, Instagram, WhatsApp, TikTok.
Okay.
This is really competing with healthcare in our hospitals today. I don't know if attention has been drawn to that. And maybe Madam Diana or the health professionals can help us. But I see that it is really competing for the attention of patients. And one thing that is a major distraction to healthcare is that when you are distracted, the person who is supposed to give the care is distracted. Distracted by something that is not even present, but somewhere else. Okay, and one fundamental rules of communication is that be in the present. Be in the present. So if there's somebody right in front of you, you are talking to, that person should have priority over the person who is virtual. Okay, if the person is virtual, deal with the person in front of you first before you go to the virtual person. And so I think that if we can conscientize ourselves and our health professionals about these trends that are emerging, we could help build an ideal way of communication at the health in the health centers. Thank you.
Thank you. So, Mr. Andrew Seshen, you are a professional nurse, and then Madam Priscilla, you are all in the nursing field. This submission by Mr. Richard Archer, who is a lecturer, senior lecturer at the University of Energy and Natural Resources Department of Language. You are on the field. You are on the field. So how will you respond to this? Is this thing happening? Is social media, attention to social media, having a greater part of time, taking greater part of time at the expense of time for patients in our hospital? Is this observation going on in the hospital? And if that is the case, what do we do? So let's take it up from Priscilla and then we'll come to Andrew. Pastor Andrew. So Priscilla, if you are with us, you can give your submission. Or Andrew Seshen.
Yes, please.
Yeah.
Please, can you hear me?
Yeah, we can hear you. So it's you are on the field. You are a professional nurse. Even in the Bible school, you are in charge of the nursing department. So social media, attention for social media, taking greater time of attention for our patients. How do you respond to that?
Okay, for me, I will talk for because I'm at the health center.
Okay.
I'm working at the health center. Yeah, so I'll talk from the health centers.
Okay.
Because from where I'm working, it's hardly that.
Good morning, once. I don't know if you can hear me. Okay. Hello.
Yeah, Priscilla, Andrew is online. So when he is done, then you can give your submission. Yeah, Andrew, you can go ahead.
Okay. As I was saying, at my place, it's harder that you see a health professional being on social media whilst a patient is in. Because I personally will not take it like it. And I was in charge of the OPD unit. So I will always see to it that patient first before everything.
Okay.
So for the hospitals, I can't say much about it because I'm not at the hospital. Thank you very much.
All right. So Priscilla, you can go ahead with your submission now.
Okay. Hello. Can you hear me?
Yeah, we can hear you loud and clear.
Okay. I can say yes, it is true, and it may not necessarily count at certain places.
Okay.
I've had the opportunity to be in a number of facilities, teaching region, districts, CHIPs, and health centers. And for the past, let's say 5 years, this happens to be the trend in some places. We all understand. I don't know if you remember, some time back, there was a cartoon or animation that had a nurse with a needle inside someone's buttocks, and then she was on the phone. I don't know if you remember.
No, don't recall.
It's not a nice thing. So I remember that from then on, most health facilities, nursing leaders took it up to work on it.
Okay.
So for my facility and the few units that I've been in at the teaching hospitals, I realized that you wouldn't see them doing this when there is a patient in front of them.
Okay.
I may be saying that probably because I have been at the oncologic units and the places are almost always busy. So you wouldn't see someone loitering around. Fine, you may see it as you would every other person when work is slow or when they are having their tea breaks or lunch or something.
Okay.
So unfortunately, we see it. Yes, we do. But most facility heads are working on this assiduously. And I'm trusting that with time, it wouldn't be seen as it is, or some people complain about rampantly nowadays. Thank you.
Thank you very much. So Prima, I don't know if this is Prima on our nursing medication form. Prima, is this Prima that I know? Prima. Okay. So thank you very much. Yeah, so the next question that I want to, okay, I can see Mr. Ricky's hand up. Mr. Ricky, you can give your submission.
So what I would say is that it's good the professionals have noticed it and they are working assiduously to check it. Because one of the worst things if any patient would want to come across is let me mention the place I went to and I observed this. I went to the regional hospital in Shinyani, and the nurse was completely on the phone and was lost. She was lost to her environment.
Mm-hmm.
She was so concentrated on what she was doing on the phone as compared to what was happening around her environment. And so I'm happy that the professionals are taking it up and then they are working on, because I said that the best medicine for any patients are the words you use. And the words you use could be verbal or non-verbal. If you don't create an ambience where the patients feel he can trust you, just like Madam Dana said, or he can rely on you when there's a need for it, then that alone would make the patient's sickness worse. But if the environment is conducive enough and he has the support, a lot of the healing that comes with medication is placebo. Is an environmental thing. If the person feels love in the environment that he or she finds himself, that's why most rich people would go all the way to a private facility to just to get all the attention they need when they are sick.
Okay.
But I think that the ordinary person could also benefit from it when professionals pay attention to it. Thank you.
Thank you. Do we have Angelina Abiesi, Mrs. Angelina Abiesi? I can see Angie. I'm not sure whether she's the one. Mrs. Angelina Abiesi.
Yes, David, I'm here.
Oh, okay.
Sorry.
You've been very silent. You're welcome.
Thank
So
you.
you are the regulatory compliance coordinator at the University of Baltimore, Washington, in USA.
University of Maryland, Baltimore, Washington.
All right, University of. All right. So how do you respond to this issue of having more attention on social media? How do you regulate this issue of nurse professionals or healthcare professionals and access to social media while on work? How do you ensure that this does not happen at where you are working? What measures have you put in place to make sure that that does not occur?
Thank you. So it was interesting hearing the submission by the other speakers and participants. And I think the first thought that came to my mind was, what are some of the policies being put in place? I know Priscilla mentioned, a lot of the nurse leaders in Ghana are working to mitigate this, emerging issue. For the hospital system that I work, and I think for most hospitals or most healthcare organization here in the United States, there are very stringent policies put into place to avoid these particular behaviors, most especially in the clinic areas or clinical areas. What I mean by that is, when you go to a lot of organizations, you get hired into the system or the hospitals or clinics or wherever you're being hired into. During your orientation, you're made aware of that policy. You actually have to read it and sign that, yes, I have read this policy. These are our requirement regarding using the utilization of phones at the bedside, being on social media or posting to social media. And if you are ever found to be in violation of that, then that is, I think the term is disciplinary action up to termination. So though I think personally, or from an organizational perspective, that has helped to curb, that desire to use the phone at the bedside, and also to be on social media. There are certain, times that you're allowed to use your phone when, the organization is having activities outside of the hospital. When we are in the community, yes, you can do that and you can post to social media, but it's very not allowed at the bedside. And I think for the most part, when we read, when you come in and you're given that policy and you put your name to that policy, you are more aware of the I guess the backlash should you violate that law or that policy of the organization. So what I'm wondering is, as Ghanaian nurse leaders are working to decrease, the number of incidents with social media usage or phone usage. It shouldn't just be social media. Sometimes they're on the phone, not necessarily on social media. As they're working to decrease the occurrence of such, incidents, I'm wondering if they're looking at their policies, and if they are incorporating that into, the orientation of new hires or into what we call the annual training for, those who are already employed in the organization. Thank you.
All right. Thank you very much. So at this point, I would like to give the, does anyone want to contribute to what or add to what Mrs. Abiasi has just said? I can see Mr. Ricky's up. Mr. Ricky, you can go ahead. Mr. Ricky, your hand is up.
Please, I have no comment right now, so I would entreat your judgments to continue. Thank you.
All right, thank you. So, Prema, I can see Prema here. Prema, can you add a word to what has been said? All right.
Hello.
Yeah, hello, Prema. Yeah.
Yeah, greetings to everyone.
Yeah, you're welcome.
No, but the little I can add to what has been discussed is that in Ghana, I think our leaders really didn't pay particular attention.
Yeah, you can go ahead. All right, so we lost Prema. Diana, you want to come in?
Yes, I wanted to talk about in the training institutions to what we have been trying to do. With my place like this, when they are going to the ward for their clinicals, we let them know that you can't use your phone. If you should be found on your phone, it means you've been given an assignment that you need to search, conduct a research on, and so you are looking for information on your phone. Other than that, when you get to the hospital, the same way you can't use your phone during lecture period, you're also supposed to put your phones away. If you need to pick a call, they are always told important calls do not last more than 5 minutes. So if you want to have a call or make a call, you have about 5 minutes to do that. Afterwards, put your phone away. You cannot record a patient without his or her consent. So we've been trying to somehow regulate the way they can use phones when they are going to the ward too.
Okay. So important calls do not take more than 5 minutes. Wow. So for those of us who are making calls and talking things, let's take away. Important calls likely do not take more than 5 minutes.
Interesting.
So does anyone have anything to add up to what we have said? We have a last question here. What will be how does communication enhance effective healthcare? So this is our last question, and then we'll sign off for this section of the program. How does communication enhance effective healthcare? This is our last question for the day. Anyone who want to just pick it up and then add another two to it. How does communication enhance effective healthcare? My comments are even quiet, so you can add a word to this. Idamansa. Okay, Dinah, you can pick it up.
Okay, before we go to how it affects or how the link between communication and effectiveness in practice, I want to go back to how to address the barriers. I think we didn't go much into that. And one thing that I want to suggest is having these, or if you're working at the ward, there are times they conduct workshops and trainings for staff. So if we can have trainings on the use of communication skills or even the effect of communication on the patient, if we can have trainings like that, it can help to bridge the gap and also address most of the barriers that we have in communication. And also, if we can use the teach back method, most times we communicate to our patients. At times, we don't even ask for feedback. We just, nurses, we are fond of doing that. We just tell the patient what we want to tell them and we go our way. We don't try to get to know if they got what we even gave them. So if we can ask for feedback from them, it can help. It can be a way to bridge that gap.
Come out of that. He will lead us successfully to be able to come out of that. I also expect him to assure Ghanaians and bring.
Okay. All right. So thank you very much. So how do we respond to how effective healthcare how communication can enhance effective healthcare? This is the last question for today. How does communication enhance effective healthcare? Diana and Rick, your hands are still up. And okay, we have Priscilla. Okay, let's take one from Priscilla and then one from Diana and then one from Mr. Archer. So Priscilla, you can go ahead.
Hello. Okay. I was not here when you were discussing the barriers. So let me just add, I don't know if it's been said already.
I will say that, but you can add something to it.
To add up to what Diana said, in having webinars or CPDs or trainings for working staff, okay, I think that the concept of emotional intelligence, yes, the barriers. I think that the concept of emotional intelligence should not be underrated. Majority being women. Women have our own issues with hormones, monthly hormone changes, and other home issues, and a whole lot of things. The nurse that is equipped with emotional intelligence skills can know how to differentiate between her home, her relationship, and her job. In that, when I'm with a patient, My husband, who is a man, may have decided to slap me or whatever it is that you have, the challenge you have with your husband. It doesn't mean the man that is your patient is doing same.
Okay.
Husband trivializes what you say. It doesn't mean that the man that you are speaking with will trivialize what you are saying. It will help you individuals and know how to mitigate their needs as such without any
I think we haven't.
So even if you have challenges with particular tribes, you will put it aside and be professional about dealing with them. Concerning communication's effect on effectiveness in care, I would want to say that when one communicates well, one gets results for exactly what he or she said. Example, when I was in the ward, I remember that most of my patients were not even aware of their diagnosis. So they'll go and come back a week or two later with the same diagnosis. So I just took it upon myself when I come for night duties.
Okay. All right. So I think we lost Priscilla. So Ida Mensa, your hand is up.
Yes, David, thank you. What I would
as soon as I finish with my medications, I take 2 people a day or 3 people a day, educate them on what they have to do, the ways to prevent it. And I realized that for a year or two, I had not seen them leave. It helps prevent even medical.
All right. So Priscilla, your network was not helping. Okay, so Ida, your way. You can go ahead.
Yes. Thank you, David. What I would add to the final bit is as health professionals in practice, we need to practice active listening, which is very important. And there are ways, when I mean active listening, is a way by which professional listen to their client or the patient. Um, there are steps like paying attention to a person whilst they are talking. There is a few things I did put down. You have to build a mutual relationship, boost your own self-confidence, because you, as health professional, the way we portray our confidence is also plays an important role for a patient coming to you to accept whatever you say, basically. And in communication, if you don't know, there is nothing wrong with saying, I don't know, I would refer. Do not give informations that you don't know, basically. There's nothing wrong with saying, I don't know, even though I am high this up, I don't know. I would check, I would re-refer, or I will consult. The other thing is making fewer mistakes and less miscommunications. This is where knowledge plays an important role. And then not arguing with the patient. You should approach everyone that comes to you in a non-judgmental way. Sometimes we do have our own personal issues, as previous speakers said. We have our own circumstances, our own experiences. So whenever a person comes to us, there is a saying that first impressions plays an important role. So you approaching a situation non-judgmental way helps helps a patient to have a trusting relationship with you. And we should also use up our CDP training opportunities when presented. It's good to be updated with training, with information, um, all around. Basically, as one speaker said, you should approach situation in the present rather than what I've learned previously or in the past. So basically, that's my addition to it.
All right.
Okay. Okay. So, Doug, I would want to just add my last comment. If I can go ahead.
Please go ahead.
All right. So, what I would say is that nurses must know that they play a very critical role in the healthcare system. In fact, patients spend more time with nurses than even with doctors and hospital administrators. And that is, if you know, most nurses go in shifts. So they play a very huge role in administering healthcare to patients. And a place where you have nurses spending more time with the patient than even doctors and administrators, the communication of the particular nurse, be it verbal or non-verbal, is critical. It's critical, so critical, is even critical to the revenue of the clinic or hospital, because patients talk and they recommend a lot. And so if the tag of the patient is that, oh, this place when you go, the nurses are good, the nurses will take good care of you, or the nurses speak well. Usually they say the nurses speak well. Okay, in the long run, it will help promote the image of the hospital, and it also help increase revenue to the hospital. Because if I have two hospitals or two clinics, and one clinic prioritizes effective communication, and they treat me well, they handle me well, definitely I would go to that particular hospital, as compared to the other hospital that does not in any way care about communication. So I think that if we are able to do that and be able to concentrate on that, it will really help the health system. Thank you.
Thank you very much. Madam Diana, your last word. We'll be wrapping up in the next 10 minutes. So your last word.
Okay. What I wanted to say is that effective communication brings about better patient or health outcomes, because most times patients want someone that they can talk to, someone who is ready to listen to their problems, someone who knows, as we said, who is empathetic, can put him or herself in their shoes. And when it happens like that, they are always ready to give much information to you. And so you, the nurse, you are able to curb any problem that may arise. And so it brings about better health outcomes. And mostly, since they are always willing to give much, you're also able to give your maximum best to the patient. Yeah.
All right. So thank you very, very much for all your submissions, those that came. Thank you so much. We have some information in the chat. We have the barriers, by way of recap, barriers to effective communication in the healthcare sector. We have personal, being emotional. And then we also have language. Language is also one of the barriers. Then we also learned that in all circumstances, respect, empathy, and communication must be exhibited when communicating. And we tried to conclude by saying that this can be the underlying composure when we are dealing with patients, a way of communicating. So we should have that in mind, and then we should be able to express that. We also learned that we shouldn't go too extreme in being emotional, because once you get too emotional, you'll not be able to do your work effectively. Then also we learned that providing kindness and hormones relationships and building trust. This is from Ida. So we don't know hormone relationships. Wow. Anyway, and then we learned that trust, active listening, critical thinking, and emotional intelligence. Emotional intelligence are one of the keys that we can use to overcome the barriers to communicate effectively. Then we, from Priscilla, we also learned about being confidentiality and then GDPR policy. I don't know what that is. Anyway, then we also learned that communication and effective nursing care prevents medical errors, reduces anxiety, puts power in the hands of the patient, their family, and also encourages trust. Then we also learned that, so these are some of the things that we learned. And then, funny enough, we also learned that important calls do not last more than 5 minutes, shouldn't last more than 5 minutes. I think that is very interesting to me. So thank you all so much for making it to this edition of the Ideal Nurse Drive Mentorship Program. As I can see Jacinta, Yvette, Dia, I can see Chris Bongo, I can see Nanaya, I can see Rabbi. Rabbi was with us at the very beginning of the program. And I can see Ruth, I can see Stephen Opoku, and I can see Angie, I can see Augustina Umari, and Andrew, and everyone. So thank you so much for making time to join. God willing, our last mentorship program will be in December. And so if you are new, I will just humbly request that you just drop your contact number or your email address privately to me. We'll reach out to you so that we remind you for our next program for the Ideal Nurse Drive. God willing, in the month of January, we're going to give out scholarship to the 2 individuals that, as you can see on your screen, 2 individuals have received, they went through the scholarship program, the processes, and then emerged as the recipients of the Ideal Nurse Scholarship Program for the year 2022. So we had about 10 finalists from various tertiary institutions in Ghana. And then out of the 10 finalists, 2 of them were selected based on their performance and based on the interview. They did so well. So we have Edu Hilda in Tiwa from the Kukuribia Nursing and Midwifery Training College. And then she is in level 300 for nursing and midwifery. Then we have Harriet Afi Inlimwomo from CAF University in Accra. She is pursuing nursing and she's in level 300. So the scholarship package involves a percentage, 50% of the tuition fee and then stipend for the semester, for the whole semester. And they are going to receive this in the first week of January. And so, God willing, we'll also have an Ideal Nurse Drive scholarship package for 2023. Every year, by the grace of God, we're going to give our scholarship as we also try to mentor students. The idea is to enhance capacity building among the practicing nurses, among nurses, and among midwives in the healthcare profession in Ghana. And so we'll be very happy if you will be an advocate in this regard. Share the good news with your friends. Invite them whenever we have mentorship programs. It is done every quarter, in January, in March, in June, in October, and then in December. And then the scholarship process begins in August, and then it's awarded, and in January every year it will be given out. So thank you so much for joining us. I'm so happy that you are here, and I'm very grateful to our person. Hopefully next time when we call upon you, we hope that you will be available to enhance capacity among our healthcare professionals, specifically. And at the same time, the next 2-3 months, particularly in the month of